This Medisynced ECG review will focus on case number 163 from ECG Wave-Maven. Copyright information is provided here. The following ECG shows which rhythm? Sinus rhythm with ventricular bigeminy. The underlying rhythm is sinus at a rate of about 60 beats per minute with fixed coupled premature ventricular complexes in a bigeminal pattern, that is, every other beat is a PVC. Note that the onset of each PVCs comes just after a non-conducted sinus P wave, giving the appearance of a very short PR in some of the leads. The negative deflection at the end of the PVCs in lead 2 are actually part of the QRS and not retrograde P waves. To verify this contention, measure the longest QRS duration of the PVC complexes, for example in lead V1, and superimpose that duration on the PVC in lead 2. This widest duration subtends the last deflection of the PVC that simulates a P wave, but is actually part of the QRS. The sinus beats show probable left atrial abnormality. In addition, the sinus-conducted QRS complexes show borderline left axis deviation and a minor right ventricular conduction delay. As additional notes, right bundle branch block deflections, as shown here, supraventricular or ventricular, may generate S waves that simulate narrow P waves. Another point of distinction is based on the fact that retrograde P waves are usually septal in origin and therefore equally negative in leads 2 and 3 and near isoelectric in 1. Here the P waves are positive in 3 and negative in 1, which gives them extreme left to right direction typical for terminal part of the right bundle branch block vector loop. Finally, based on their very sharp initial deflections and rightward axis, the PVCs themselves likely originate from or close to the left anterior fascicle.